Good evening, everyone. On behalf of International Homeopathic Foundation, I welcome you all once again. ये IHF की हिस्ट्री में भी पहली बार हो रहा है कि बैक टू बैक हमारे दो वेबिनार्स हो रहे हैं विद डॉक्टर दरयानी सर एंड ऑल थैंक्स टू डॉक्टर दरयानी सर हु हैज मेड सो मच ऑफ एफर्ट्स फॉर ऑल ऑफ अस कि उनके इतने साल के जो एक्सपीरियंस हैं वो हमसे शेयर कर रहे हैं. So, on behalf of International Foundation, I welcome you all on this platform. Before we move forward, IHF जो new है IHF के लिए एक छोटा सा introduction है IHF का. IHF was founded in the year 2015, which aims to promote homeopathy through academics and integrated approach. Since inception, we organized various free health camps, seminars, homeopathic medical education series. The most talked about 3 days successful International Homeopathic Congress was organized at Taj Vivanta, Dwarka in April 2016, where more than 250 doctors, researchers participated globally. We have also organized virtual International Homeopathic Summit and mega panel discussion, where we had all these eminent speakers with us, जिन्होंने अपना हर एक एक्सपीरियंस कोविड का जो उनकी रिसर्च हो रही है या जो उनके एक्सपीरियंस क्लिनिकल हैं वो सब हमसे शेयर किए उन्होंने. IHF has also organized a joint webinar with Lung Care Foundation to create awareness in society against increasing pollution and its harmful effects. We have proposed credit system for homeopathic doctors to Ayush department, which is in progress. IHF has started a learning campaign on social media, Let's Learn Together, and it has completed more than 200 days. Management of IHF team is Dr. R.N. Wahi, Dr. Muktinder Singh, myself, Dr. Amita, Dr. Bhavna, Dr. Monica Singh, Dr. Gurbeer Kaur, and Dr. Vinod Madan sir. So before we move forward, एक छोटी सी formality कह लीजिए. Dr. Daryani एक नया नाम नहीं है हम सबके लिए. He is a very well-known person, and I must tell you कि जब हमने webinar announce किया सर का, तो उसी दिन हमारा actually हाउसफुल हो गया था. हम लोग बहुत एफर्ट्स कर रहे हैं कि कोई भी हमारे होम्योपैथिक फ्रेंड्स जो हैं, कलीग्स जो हैं, वो डिसअपॉइंटेड ना रहें और सब ये इनका वेबिनार अटेंड कर पाए और इनके एक्सपीरियंसेस से सीख पाए. ओवर टू यू डॉक्टर मोनिका.
Yeah, thank you, Dr. Amita. Very warm welcome to you all, and feeling privileged to getting a chance to introduce such a senior person, fatherly figure whom I respect a lot, Dr. Daryani sir. So, as a formality, I have to give introductions so everybody knows him. So,
Monica,
Hanji sir.
please.
Hanji
Monica,
sir.
please don't give any introduction. I'm self-introduced person.
वो तो सर बिल्कुल सही बात है.
But then forget, because last time the people have
अच्छा ठीक है सर.
to
ठीक
save
है
the
सर.
time.
ठीक है सर.
ठीक है
जैसे
सर,
आप
आप
जैसे
जैसे
आप
बोले.
ठीक समझे.
बिल्कुल बिल्कुल ठीक है सर. डॉक्टर निशांत, मैं अपनी शेयरिंग स्टॉप कर रही हूँ अब, ताकि आप सर की स्लाइड्स शेयर कर सकें और सर हमें बता सकें.
Shall
So
I share my
you
screen?
will be the presenter now.
Okay.
Are you able to share?
Dr. Amita, it's coming. Host disabled, participant screen sharing.
नहीं, सिर्फ आपका ही शेयर होगा जी.
No, it's
Let me
repeatedly coming.
Let me just check. डॉक्टर निशांत, आपके शायद मोबाइल पे जा रहा है, OnePlus Nord 2G पे होस्ट के राइट्स जा रहे हैं।
It is repeatedly coming. Host disabled participant screen sharing.
But I have already given you the sharing rights actually.
हो नहीं पा रहा है ये.
Just give me a second, जी.
Sure.
प्लीज चेकअप डॉक्टर निशांत, अब आप कर पाएंगे.
Just a second. Yes, it is.
है ना?
Is this slide visible?
Yes, yes, please.
So shall we start?
Yes, please.
नहीं,
Thank you.
पहले परमिशन डॉक्टर साहब से परमिशन लीजिए, भार्गव सर से परमिशन लीजिए. भार्गव सर से
डॉक्टर ऋषि भार्गव सर, डॉक्टर ऋषि भार्गव सर प्रोफेसर डॉक्टर J.D दरयानी सर के गुरु हैं, सो उनकी परमिशन डेफिनेटली बहुत जरूरी है. डॉक्टर ऋषि भार्गव सर, आप मुझे सुन पा रहे हैं तो काइंडली परमिशन दीजिए, अनम्यूट कर लीजिए अपने आप को. आई थिंक सर उन तक ऑडिबल नहीं हो रहा, या तो
अभी तो आवाज आई थी. एक बार फिर करिएगा.
डॉक्टर ऋषि भार्गव सर, आप प्लीज अनम्यूट कर लीजिए अपने आप को.
Is it audible now?
यस
Yes,
सर,
sir.
यस
Yes,
सर.
sir.
Yeah,
Sir.
Dr. Daryani, please start. You
Yes,
are
thank
getting
you,
late.
sir.
All the best.
Thank you, sir.
थैंक यू सर.
Thanks. सबसे पहले मैं अपने परम गुरु डॉक्टर ऋषि भार्गव साहब को हृदय से प्रणाम हूँ. गुरुदेव प्रणाम स्वीकार करें. सर, आज जो कुछ स्किन में मेरे को लोग समझ, सब आपकी देन है. Whatever I am today, it is only because of you. So I dedicated this lecture to you, to my Gurudev. Next, sir.
Yeah,
Now,
thank you.
well, tell me one thing, or from audience, I will ask one thing. Who populared the skin? I mean, homeopathy, only one word, that is what? इसकी तो होम्योपैथी में दवाई है, इसकी तो होम्योपैथी में दवाई है. I think it is the only word, rather it is the disease, or it is term medical varuki, which has given the honor to homeopathy. Right from a pan wala, rickshaw wala, and even in doctors themselves, they say, thuja le lo, thuja le lo, thuja le लीजिए. होम्योपैथी में तो सिर्फ thuja ही है. Well, there is thuja is a common medicine, but it is depends upon the skill of the physician. We should keep one thing in our mind, that the disease picture plus the individuality is equal to homeopathy. We should not forget to individuality. Our skill is to find out the individuality, the case taking. So I start with here most familiar term, but Dr. Bakshi is not seems to me here. Dr. Bakshi sir, he is the lion of homeopathy. Dr.
I
Bakshi
will
sir
check,
must
sir.
be here.
I will check, sir. I'll check, sir, and let
Dr.
you.
Bakshi sir,
I will check, sir, and let you know.
oh, okay.
You
Well,
can continue.
Well, I start the first slide. What type of varieties of words are here which we encountered with our homeopathy? Now, this is a word. Next. Well, the look is very dangerous. Very dangerous. Now, the whole lower lip is full of growth. And from the right side, if you observe, there is also a projection that is a horny look. And similarly, where he has put his finger, there is an also growth. Well, I must tell you, he's a quite young boy. When he approached in my clinic, my chamber, with reference of my student, and brought one slip where he was given so many medicines, which common medicines which he has used. But the point is, what was the appearance? That is something different. Our case taking starts from the patient enters inside. A patient enters in the room. It was horrible of foul spelling. Horrible. Just I put a napkin on my nose. I thought this smell could be from his feet, or rather you can say the stockings. But I said, ये मोजे बाहर खोल आओ. मोजे भी खोल के आया. फिर भी. Anyways, I said, आप बाहर बैठ जाओ. और बाहर बैठने के बाद में थोड़ा सा रूम फ्रेशनर स्प्रे किया, और थोड़ी देर बाद में हमने वो स्लिप देखी, और उस डॉक्टर से डायरेक्ट बात की मैंने, जिसने रेफर किया था कोटपुतली का, डॉक्टर गुलाब चंद चौधरी. और वो सारी बात सुनने के बाद में मैंने उनसे कहा कि मैं केस टेकिंग नहीं कर पा रहा हूं प्रॉपर, बिकॉज दिस थिंग इज देयर. ही सेड, सर जो भी आपको अच्छा लगे. मुझे और कुछ अच्छा नहीं लगा, सिर्फ एक ही बात समझ में आई कि इसकी स्मेल कम हो, ये सड़ रहा है. नाउ do you think what medicine I could have prescribed, I should have prescribed? See the next slide. Well, this is follow. Here he was given echinacea in the potentized form, as well as echinacea mother tincture in the distilled water for gargles. and he was asked to visit after 7 days. Now this is the position after 7 days. From the left side, look at this. Now I was really surprised. Okay, is it possible that echinacea can give this drastic change? Now the patient was almost non-smelling. I mean, he was not having that type of. Anyways, I was very much excited. But there was a point that this fungoid growth may turn into malignancy, for which he was asked, any investigation has done. So he said HIV and all other investigations have done, that is negative. Then I asked about family history, then it was positive malignancy in the family. But such a nice boy, very innocent, a lovely chap. But we thought, we means both my best friend, Dr. Nishant, and we prescribed the carcinosin. Now you will ask why you have changed the prescription. That I've already told you, this is depends upon the physician who understands the case in his mind. It is not an hard and fast, one should give the explanation. It is not a court of law. It is the skill of physician, it is the mind of physician who decide which this medicine can work. Because my point was here to change into malignancy. Earlier it was foul spelling. Now see the follow-up. And the last left side slide, it is, right side slide is complete vanished off. In between follow-ups, he said, डॉक्टर साहब मेरी शादी नहीं होती है. क्यों लोग गलत समझते हैं? मैंने इतनी बार पहले भी पूछा उससे कि तुम गुटखा, पान मसाला या बीड़ी सिगरेट पीछे हो, पर कोई ऐसी चीज समझ में नहीं आई. क्योंकि मेरे को डाउट हो रहा था कि इसके दांतों पर नीचे लोअर टीथ पर कुछ कैरीज है या पिगमेंटेशन है. एनीवेज, भगवान ने उसकी सुन ली और उसकी शादी हो गई. अपनी मिसेस के साथ जब आया तो मिठाई का डिब्बा लेके आया. मैंने उसकी मिसेस को शगुन के रूप में जो कुछ भी था वो उसके हाथ में दे दिया. Thanks to homeopathy, thanks to what? And this I presented case in international conferences also. Well, next. Well, this is also a classic case. Now, I always believe in what you see, that is objective, then the subjective. When he approached, we were looking at him. Now see, upper lip near the tip of the nose, there is a growth, spikes are there. See, left nostril, below the left nostril, there is spikes, a bunch of spikes. On the lower lip, there is a spike. Next. Now there is a growth over the ear, backside of the ear. Similarly, there is a growth in in the thumb portion and fingers also, lateral as well as posterior, palmar as well as plant. Both sides. Next, sir. Now there is a story or mystery, rather I can say. Our first look was at his broad lips, backslide. Now broad lips. Second was this word. Then we were discussing with each other, this appears to be something abnormal. Then after discussing, we asked the parents, initially from father and then mother. The mother told him she had frequent miscarriage in past. Well, this was quite sufficient for us. And we prescribed medorinum. But this was not sufficient to satisfy you, because I tell the individuality, it was only families. The individuality was when he was asked what type of nature he is, what is his level of studies, what is his level of IQ. When we were discussing, then we came to know that he is average student in the class, but always brings complaints from the teacher. For what? Because मस्ती ज्यादा करता है, बच्चों को मारता पीटता है, टीज करता है, लड़ाई झगड़ा करता है, पढ़ाई में ध्यान नहीं देता. Now this is not thuja, mischievous, मार पिटाई करना, dull and broad, abnormal and venereal side. Now, though it should be viral, but according to our approach, we thought of prescribing medorinum tenum. Next. He was asked to report after 1 month for follow. Now this is the picture. We cannot give a good shape to his lips, upper lip, but the growth, spiky growth are almost vanished off or disappeared. Ear, behind the ear which was there, but now the growth is lesser in comparison to that. Or both hands, fingers, clear, thumb itself is clear, and fingers of right side palmar surface is also clear. Next. This is a classic picture that I have seen on the video, because, well, this was early started with the corn and then followed by wort. And what type of wort? It is plantar wort. Now, what is the difference between wort and corn? The plantar wort is disc-shaped, but the surface of the skin is irregular and thick and painful. While the corn is just a growth, a tiny growth, seedy growth, which sensitiveness, which sensitiveness gives the pain while on bearing football. Now gradually this has turned. Earlier we were considered with the corn, and for that reason, so many times, 2 or 3 times she underwent for surgery, but again the thing gradually appeared. One of my best friend, rather I should mention his name, Dr. Manchanda once said that Daryani, it is a plantar wart. Now his plantar wart having pain, sensitive to touch, Ruta was given. Well, with Ruta, now you will ask one more thing with me. Perhaps Dr. Chauhan will ask, if surgery has done, and then after this type of appearance or growth again and again with sensitive to pain, why not staphysagria? Dr. Chauhan, sir, this I learned from you. Staphysagria I learned from you, but at that time I gave Ruta. Pain, wart with pain. Later on, yes, she was calcarea floor, because pain is not noticeable or felt, but simply growth is there, hard growth, pain less growth. She was given calcarea floor. Next. Well, here is the scab. Lower side, 3 layers has removed, and now completely it has removed. Now this is again wart. It is not thuja. Next. Well, this from villager, 29-year young person having multiple spiky growth on the face and neck, front side. Now, you must have heard the jagged type. Jagged means nukila. Nukila, spikes, cauliflower-like. Here it is same thing. Now this is only in causticum. Causticum has got warts on face, any part of face, even on eyelid. Second variety of causticum is pedunculated. And third type of wart, it is just काले काले से दाने से होंगे, छोटे छोटे से दाने से होंगे, लाल लाल या काले काले वो फैले होंगे, flat. Now this can be seen in later cases, but now here it is. Second slide after treatment. Causticum. Next. Well, here it is again vulgaris. Vulgaris, full of bunch of, he is not able to shave. This is simply a trimming. Now he was also given the causticum because cauliflower-like growth and spikes are visible. Tentacles, we can say. And this is the after treatment. But still he is doing trimming. Next. Well, classical, this kind of perianal wart, this was referred from a surgeon. Generally, he refers such type of cases to us. Not to me, but Dr. Nishant. He knows only Dr. Nishant. Now, he said, यार कॉटरी करनी पड़ेगी और इसको बड़ा परेशानी होगी और ये होगा कि इसको आप देखो. पर उनकी एक आदत है डॉक्टर साहब की कि जब पेशेंट आपके पास पहुंचे तो मेरी बात कर लिया करो और जब ठीक हो जाए तो वापस मेरे पास भेजा करो ताकि ही शुड फील कि मेरे को सेफ हैंड से भेजा गया. नाउ spikes are seems to be here, bunch of spikes, but it is location is different. It is called in medical terminology condylomata. Condylomata. But location is genital area. Here it is perianal. Now this is second slide on the right side. इसका कार्ड निकालना. मेडो शायद मेडो दिया है. Because venereal warts, yes, he is Mr. Ajay Kumar Sharma. Perianal wart, multiple, various size, gradually spreading, history of fistula annum and constipation, and recurring tonsillitis, etc. Patient is hot and prefers sweats 2+, and he was given with medorinum acetate at 10 mg, 1 dose, followed by placebo. And within the for 2 months period, this thing is like this. This is the last. No medicine was prescribed except placebo. But he didn't turn up after that. Next. Now this is another case of little boy of 4 years age only. ये डॉक्टर साहब ने नहीं भेजा था, ये उनके पड़ोस से किसी से रेफर होके उनके कहने से आया था. नाउ क्या नाम है इसका? आरव. आरव. Now I don't know why we are. Arav is also referred by Dr. Kaushik. Yes. Yeah. Puja. But Puja was not giving a satisfactory. So king of psychosis has failed. Then we went in favor of, we have to consider in favor of medorinum. And again, this boy was, not again, but again for this case, medorinum was prescribed 10 mg, and this condition is here. Now, this is almost 3 months picture, 3 months duration. Next. Now this is genital wart. Is the same condylomata. But now you see the spikes are here. Very different. Growth is cauliflower-like growth. Now, what should we give? What should we prescribe? Should we prescribe causticum? Shall we prescribe thuja or something else? My dear friends, again the history is very important. Whatever it is, but history, case taking proper should be done. In case taking, there was multiple sexual indulgence. Since venereal warts are contagious, with this we prescribed Madorinum. Next. Now this is the follow-up. Next. This is the recent case which is under follow-up. Initially, yes, Mr. Hansraj. Now he has got this type of complaint, that is a spot, but dark brownish spot. But on case taking, there were so many things. He is having allergic dermatitis, allergic rhinitis, and later on he developed these cracks, fissured skin around the periphery, and this foreskin, and still change of weather aggravates the allergic condition. History of diabetes and hypertension. He was on conventional system of medicine. Family history, diabetes and allergic is persisting. But now, initially, considering the allergic background, itching, we started with sulfur. But sulfur has given no relief. So, considering the location and this growth, we decided to prescribe Thuja 200. Now Thuja has given this picture. But after that, there was no response. Later on, he was put on Madorinum. Now, why Madorinum? Huh? Yes. 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 Next. Now, this is the present. This is the recent follow-up of visit of patient, this right side. Now you will ask me why I have prescribed the Madorinum. Why initially sulfur? Because itching is persisting.
Allergic tendency.
Allergic background is there, but not so much improvement. Itching was reduced, but discoloration was there. So much so, he was on steroids also. So then I thought I must give Thuja 200. Generally, we prescribe the high potency, but in this case, we prescribed Thuja 200. But later on, Thuja doesn't respond, and Madorinum was considered. Now, Sora, psychotic, syphilitic. Now here it is psychosyphilitic and Sora psychosyphilitic. Sora, tubercular allergy. DM, diabetes and hypertension, psychotic. Location is venereal. Now, this considered to prescribe the Madorinum, and this Madorinum, since after giving the Madorinum 10 mg, there is a great change, and this is only 3 months period. Next. Well, this is a different type of what? Plana. Varupe plana. Small dots growth. Here in the left side, just below the lower lid on the right side, and in here, right side, there is a small growth, plain growth, even near the chin, right side. Well, next. But you will surprise, this case was for us disappointing because she was not giving any response from any medicine. We started with the Dalkamara because of this flat wart. But later on, there were another complaint, then another complaint. Since long she was been not giving any response. The once she said, "Ye theek bhi hoga ya nahi hoga," this gave us an alarm. Then we took a history, detailed history, because one history is not sufficient. We have to take 2-3 times a re-history, retake. When in detail, mental picture was very important. She was very much religious, very honest. जो कुछ भी उन्होंने बताया कि मैं पैसे देने घर गई, मेरे पास एक्स्ट्रा आ गए थे, मैं घर से जाकर उनको वापस दे के आई। एक लंबी कहानी थी, और वो बताते बताते यहाँ तक आया कि आज भगवान ने हमको सब कुछ दिया है, पर मेरी आदत है कि जो कुछ मेरे यूज करूंगी, मैं उन्हीं चीजों को यूज करूंगी। मैं आज अल्ट्रा मॉडर्न जो स्टाइल है उसको फॉलो नहीं करती। ओ मोस्ट ऑनेस्ट, ट्रेडिशनल, not accepting any change, having the gastric issue also. एक लेडी के लिए उसका चेहरा सबसे बड़ी इंपॉर्टेंट चीज होती है, उसका लुक। हमने कहा कि दवाई कल देंगे, कहते मैं तो वापस निभाई जाऊंगी, अभी इतने दिन थोड़ी रुकूंगी। हमने कहा भाई ठीक है, शाम को आके दिखा दीजिएगा, फिर हम जब तक डिस्कस कर लें। एंड अल्टीमेटली रेपर्टरी खोली, और रेपर्टरी खोलने के बाद में 2 ही मेडिसिन सामने आ रही थी। मेन मेडिसिन थी काली कार, एंड काली कार देने के बाद में ये फेस इस तरह हो गया। हमको 1.25 साल करीब लग गया इस केस को हैंडल करने में, because flat warts are also present in sepia, but appearance of sepia is not here. Look is quite smart. Anyways, now my dear friends, I must share with you, we don't have any specific medicine or specific complaint, but it is our approach in the deep, that is to trace the individuality. Now, individuality depends on whole, physical journal, mental journal, particulars, subjective, objective, thermal, and all other concepts. Now, largely it was our mistake. Initially, we doesn't consider the mental. But now, this time, thoroughly we drilled, and with the help of repertory, there were 2-3 medicines given, but
Dr. Nishan, we can't hear you. Dr. Nishant, can you hear me?
Yes, Dr. Amita. Just a second.
हाँ जी, I think we missed few points अभी जो आपने सर ने बोले. We missed your audio actually, and आपका sharing भी
well,
record.
I should repeat करूं? मैं रिपीट करूं?
हाँ जी, please sir, last का.
कहा था कि हमने इतने साल ये देने के बाद में भी जब डिसअपॉइंटेड हुए तो हमने रीटेक केस किया, और उस केस के अंदर हमको सिर्फ एक ही पॉइंट नजर आई, मेंटल पिक्चर थे, और वो मेंटल पिक्चर रिलीजियस, बीइंग अ ट्रेडिशनल, ऑनेस्ट एंड कंजर्वेटिव। मुझे कोई नई चीज नहीं काम में लेनी, नई चीज यूज नहीं करनी, नया कुछ नहीं लेना, मैं तो सिंपल ऐसे ही ठीक हूं। जबकि फैमिली सब कुछ ठीक है, बड़ी अच्छी फैमिली है। मेरी जितनी भी बाकी देवरानियां हैं या जेठानियां हैं, वो अपने ढंग से चलती हैं, मेरे से कहती है नहीं कर, यानी शी इज नॉट कॉन्शियस फॉर लुक, I mean dress up and all other things. So with the help of repertory, we prescribed the Kali card, and
Dr. Nishan, am I audible to you?
Yes, Dr. Amita.
हाँ जी, बीच में वॉइस मिस हो रही है सर, थोड़ा सा नेटवर्क, आई थिंक नेटवर्क इशू
लॉस्ट
है.
हो गया था।
हाँ जी.
इसको ड्रॉप कर दीजिए, आगे बढ़िए। इसको आगे बढ़ाइए, बाद में देख लेंगे। मैं लास्ट में बता दूंगा। नाउ दिस इज अनदर केस, अ वेरी डिफरेंट वैरायटी। दिस इज वरुका वल्गरिस। वल्गरिस मीन्स वल्गर। वल्गर मीन्स वल्गर। मैं क्या बोलूं हिंदी में इसको? मल्टीपल वल्गर शेप मतलब बड़ा गंदा शेप। I don't know why the technical obstacles are there, but
Yes,
it
sir,
is
yeah.
technology.
स्क्रीन पर जो है
The
इनका
history is
म्यूट नजर आ रहा है.
हाँ जी सर, आई थिंक वो नेटवर्क का इशू हो रहा है कुछ, जस्ट बिकॉज ऑफ द नेटवर्क, नथिंग एल्स. डॉक्टर निशांत, वी आर ऑडिबल टू यू?
Yes,
हाँ
very
जी,
clearly, Dr. Mitra.
हाँ जी, अब आपकी स्लाइड विजिबल है और आपका वीडियो भी विजिबल है. थैंक यू.
well, this case was Varuki vulgaris. Now, what is vulgaris? Vulgaris means vulgar. That you know, I cannot speak in Hindi the meaning of vulgaris, but it is ugly look and bad. Whatever it is the smooth words. Now, after so many homeopaths, she visited us, and on history taking, जयपुर के उस मकान में जहां झोपड़ी में ये लोग रहते हैं, वहां पानी भर गया था बरसात की वजह से, वाटर लॉगिंग। और उस पानी को निकालने के लिए शी वॉज अलोन हरसेल्फ, घर में कोई और दूसरा फैमिली मेंबर नहीं था, तो बाल्टियों से पानी भर भर के 2-3 दिन के अंदर उसने पानी बाहर फेंका। अब इतने दिन से हाथ पानी में भी काम करने के लिए चाहिए, घर में जो भी रूटीन वर्क होता है वो भी हुआ। धीरे धीरे 15-20 दिन के बाद में एक के बाद एक दाना उभरने लगा। मकान में अभी भी सीलन है, डैम्प हाउस है, वैसे उनका बताना है। पानी में रोज हाथ डालना पड़ता है, बट दिस वाज नॉट सफिशिएंट। दिस इज इन्वायरमेंटल। नाउ मॉडलिटीज को तो से भूल जाते हैं। Then recurring illness, any background. Then background was कि थोड़ी सी भी ठंड बर्दाश्त नहीं होती है, जुकाम खांसी आता है। Now damp, getting wet, recurring cold from slightest exposure, and smooth word she was given. And unfortunately, soon after first visit, there was COVID-19. And हमारी क्लिनिक करीब 2 साल बंद रही, क्योंकि ऐसा प्लेस था कि उस जगह हर एक कोई आने में डरता है, क्योंकि बराबर में मेडिकल कॉलेज, हॉस्पिटल है, और हमारी बिल्डिंग भी पूरी अपने आप के अंदर पूरी हॉस्पिटल है। सो मच सो टेलीफोन पर हमारी जरूर बात होती थी, और निशांत जी ने, डॉक्टर निशांत ने कुछ मेडिसिन निकाल करके वहां से अपने घर पे और कार्ड्स रख रखे थे, और हम मेडिसिन उनको घर से देते थे, और कोई मेडिसिन नहीं दी, प्लेसिबो देते रहे, कम होता रहा, कम है, पहले से कम है, पहले से कम है। 2-3 महीनों के बाद में उन्होंने अप्रोच करना बंद कर दिया। आई थॉट इट मस्ट हैव वैनिश्ड ऑफ। नेक्स्ट, Rajasthan, from where I belong, is a hot place. रेगिस्तान, मरु, थर, थर में तो ठंडक होती है, मरु के अंदर गर्मी भी होती है, ठंड भी होती है, रात ठंडी दिन गर्म। अब यहाँ के जितने भी लोग हैं वो गर्मी के मारे परेशान हैं, और दूसरा हमारी लाइफ स्टाइल, टाइट क्लोथिंग्स, जीन कल्चर। नेक्स्ट, there are other things also. Say for ladies, female traditional, they cannot wear loose clothes. Always साड़ी में बंद है और बैठे रहती है। टीनिया मीन्स कैंडिडा ग्रुप के लिए heat and moist are the main. Now this lady, there are different types of tinea or according to location. This is fascia. This is sericinata. Why sericinata? Because it is in the circle, a definite circle. There are two types of circles. One is oval and one is circular. And one is irregular, that is amoebic shape. Now this circular circinata, now look at here. Shall we give the tellurium, which is a specific definite circle, or something else? तीजा की निकालना कार्ड। जबकि ये पेशेंट हमारा बहुत पुराना है जो चलता आ रहा था, लास्टली इसको टीनिया क्रूरिस भी हो गया था, वो भी ठीक हो गया, लेकिन फेस पर आ गया। इसका मतलब ये लोकेशन चेंज कर रहा है। नेक्स्ट, ये लोअर लिम्स पर, ये आफ्टर फॉर। नेक्स्ट, खत्म। नाउ तीजा वाज गिवन, lastly she is put upon whatever it is, pulsatilla. There is no, fixed medicine in homeopathy, but it is with this symptomology, because since long she has been suffering from one another complaint, and this and that. But here changeability was marked, and with this patient was emotional, sensitive, and all other things which are in favor of pulsatilla. Next. This is amoebic shape. This is corporis, because upper portion of body is the corporis and lower portion is in favor of cruris. Huh? Genital area is cruris, lower portion is genital. What an ugly look. Horrible. She's, I think, the lady. Which lady? Yes, Sunita Papediva. Well, next. This was the follow-up. Next, second and last follow-up. Next. Next. वापस पहले. Now you must be thinking what medicine I prescribe. Tinea corporis. This is not a point where one can say कि heat and moist. But the whole picture was in favor of Merksor, according to history. So Merksor was given here. I must tell you, humid and heat, night aggravation, salivation, unsatisfactory stools, and history of recurrent ulcers, mouth, that is apathy or stomatitis, were considered, and she was given. This is not specific that this medicine should be given for cruris and corporis or this for this facial. It is according to presentation of case and skill of physician. Next. Now here it is. Just I was telling you the traditional पसीने में काम करती रहती हैं ladies. She's old, not old exactly, but obese, distended abdomen, sweating, and all other things. और खाना बनाते टाइम पर चूल्हे के पास में बैठने पर खुजली बहुत तेज चलती है डॉक्टर साहब, बहुत तेज चलती है, जान निकलती है. जो पसीना आएगा इसको टच करेगा खुजली बढ़ेगी. नाउ व्हाट इज शी इज नेहा शर्मा. नाउ she was also given Merksor with the background, but the recurrence was there. This is the very challenging point before us. Finally, as it is mentioned in the literature, tinea recurrence can be checked with the basilinum, and recurring cough and cold can be checked with the finally tuberculinum, and tuberculinum finally should be logged with the thuja, according to Burnett. Now I use basilinum here, and with the basilinum last dose she has covered all these things. Because recurring word is there, it means it will reoccur. And tinea always reoccur. Next. Now we were telling you about the lower part of the body, that is groin, genital area. This is. What is the difference between a normal skin dermatitis and tinea? What I say, perfect margins are there. These margins are always to be clinically considered in favor of Candida group, because it is always mentioned when margins are there, then it is to be considered in that way. Now this aggressive look, inner wears, they always are in favor of that. Earlier I told you about this lifestyle, that is tight clothing, jeans culture. Since jean culture, now the urban people have also started this, getting this tinea cruris. Now this is a tight underwear that has given, and this crease considered to be warmed and moist. As I told you, while asking Jaipur region or nearby that, the water has got a typical property, that constipation. Now, what type of constipation is not a general term, but we have to go in the particular way. That is unsatisfactory stool. And the reflexes of that is mouth, apathy. And because of that, sometimes it is salivation. So, keeping in sequence, my Jaipur people, candidial people, having candidate, they are all 90% they are in favor of mercurius. It is a research topic, but you will appreciate that I have given this topic to my student, and he has, in survey and findings, Jaipur water is solely responsible for EH. Antiba is Antiba or Histolica. Amoebiasis. Prone to that. Second, outside the skirt area towards Sanganer airport area, that is hard water containing the fluoride. Well, I am not discussing here this thing. So, for practitioners, we should also know the regional predisposing cause or maintaining cause. Next. Well, he is the follow. Next. Yes, clear. Now this time you will see he has changed his underwear as per our advice. Loose clothing, loose underwears. Next. Well, this is again a case. Though he has weared loose, but this margin is reminding for the same. Next. This is a follow-up. Next. Well, इसका क्या नाम है? कार्ड बनेंगे माता प्रसाद चलिए. Now this he was also given mercurius. Next. Kana used to the nickname is Kana, सांवले रंग का, बट इसके था इसको देखिए ये सारा दिन सिंथेटिक चड्डी पहने हुए रहता था. घर पे आया, हाफ पैंट उतारी और बस उस चड्डी में घूमता रहता. और ultimately he developed this thing. Now, nickname was Kana, और चड्डी में घूमना. ये तो छोटे बच्चे की बात होती है, but he is not a छोटा बच्चा. This is young person. Next. Discoloration of skin with the margins, with the constant moisture and heat and synthetic use could be the allergic manifestation, but margins are clear. So we can say it is candidal group. So next. Now this is a different type of case. Location-wise, tinea facie, that was cruris, earlier was the corporis, and here it is again location-wise the facie. See, this is the zoom picture. Right side is zoom picture, and originally this is from a routine picture. Next, both are the same. Next, this is the follow. This is again a zoom picture. Next. Now it is clear. Next, वापस ला. And here it is zoom. It is clear. Next. Now, दो स्लाइड, दो चार टॉपिक्स की दिखानी है, बाकी तो सब आप जानते ही हैं कि it all depends upon the presentation of case. But diagnosis should be made because code of conduct is with us. So we must write the diagnosis. Sometimes I still take the help of my guru, Dr. Bhargav sir. Sir, what kind of diagnosis should be made? Medical terminology. So what patient presents, care of this, and with all other things, whatever it is required, it should justify the medicine. And simultaneously, when you are going to repeat or change the prescription or the better, you must give an indication. Generally, I give better 1+ or 2+ or 3+. So advise placebo or other change. If I change, then there must be mentioned in the side what kind of changes you have noticed and why you are changing the prescription. Now it is ethically correct. We should follow. Next. Now these are simple things which you are encountered. Rubber, nickel, metal, this and that, and even a sun allergy or whatever it is. Sulfur and mud salt is the most common medicine. Next. Well, this is a beetle dermatitis. Fiery look. She had been under treatment of conventional system of medicine with local application, topical applications and all other things. But she was not much relieved. Lawyer person. He was not much relieved. Belongs to very high family. The parents were of Jaipur, and in large side, personal IG and suggested for me was by SPCBI. Now, all of a sudden रात को उठा, ये दाने और जलन और खुजली बहुत बुरी होती गई और टॉपिकल लगाया, ठीक नहीं होता, वापस हो जाता है. इसका लुक को देखिए, फायरी लुक. erysipelas have become now papule, mucopurulent, blisters. Originally it is blister type, erythematous. Now this is the only look. That is the medicinal drug picture. But what is with her, with him? It was yes. What it is look? Canthris burning, vesicles, better by cold. Most common medicine. Now, why it occurs? Some people say कीड़ा काट गया. Beetle itself is a कीड़ा, insect. But it is काटने से नहीं होता, I think so. वो जो secretion है, that is chemical. That secretion causes this type of thing. That is canthridin. And from canthridin, the same medicine, if it is potent, to given the person, I mean, it is the homeopathy. So canthris was given. Now, sometimes the disease picture help us to prescribe the medicine. Next. This is again a person, male patient, having the same type of complaint, but location is changed. He has taken a lot of the medicines, but now the point is कि मैं बांह को मोड़ नहीं सकता. रात को सोता हूं तो सुबह सीधी नहीं कर सकता. जिस करवट रखा वहीं रह गई. Now this is stiffness. And this stiffness is not a drug picture at all. Disease picture. It is individual picture. Rustox has got different types of eruptions. And the drug, a disease picture resembles also in his Rustox, even a pemphigus. Rus vinita and Rus tox. But here it is stiffness, erythematous, and earlier it was vesicles, blister type. Suppression is there. You will think, why not I prescribed the sulfur? Because sulfur has got itching. His main complaint is here is stiffness and erythematous look. Next. This was given Rustox. He was given Rustox. Next. Well, this is again the same type of patient. This is a young man. Now everybody can guess. It is a drug picture. Disease picture I told you. And this is drug picture. Yes. Edematous swelling, redness, puffy swelling. Whole cheek is red. Cannot tolerate heat. ठंडा पानी लगाता हूं तो मुझे अच्छा लगता है. पर चुभन सी होती रहती है. Apis mellifica. Same type of disease with one is canthris, second is Rustox, and third is. So homeopathy never is any specific medicine or patent medicine for any disease. What is common for all, but we have differentiated, given the different shades of what, and according to the look and presentation and individuality. Well, now, something else? और भी है
next week उस पे जाएंगे.
next. Oh yes, yes. This case I have just discussed with Dr. Bhargav sir. Now whether it is thick, chapped skin, dry skin, cracked skin, could be psoriatic, but it is keratoma, keratoderma, palmar keratoderma. The location changes, then it will be the different type. Like Candidus, Candida group. Here, same thing is here. Now this chapped skin. This is a lady working in village, farming is the main thing for them. Now this was a very, it is to be considered due to the deficiency of vitamin A and also vitamin E. Deficiencies are always in favor of psoric. Deficiency means dysfunction of. So now, how we can cover up the deficiency? We don't have any vitamin A or V preparation with us. But anyways, with the background, कि खेत में काम करती हैं, गर्मी लगती रहती है, और ये चमड़ी काम करने से, ऑक्यूपेशनल काम करने से धीरे धीरे ये निशान पड़ते गए और चमड़ी मोटी होती गई. Now thick, chapped skin, dry skin, but not itching. But working under sun, means sun is not bearable. धूप अच्छी नहीं लगती पर काम करना पड़ता है. Sweating है, sun disagreeable, sun heat is disagreeable. चूल्हे के पास खाना बनाते टाइम पर अच्छा नहीं लगता. Now this is natrum, I think so. But we should not forget the graphitis and antim crude and as well as alumina. And lastly, I can say if more fissures are marked, then it could be the fluoric acid. But here, she was given graphitis because she was chilly.
Sorry, sir. Sorry to interrupt. I think Dr. Rishi Bhargav, sir, wants to say something.
Yes. Yes. Yes, sir.
Am I audible?
Yes,
Yes,
sir.
sir.
Yes, sir.
I have heard whole of your lecture. I have seen all the slides from number 1 to this one, last one. One thing which I want to stress is that meaning of the word vulgaris is common. It's not vulgaris means bad or looking bad.
Look wise, sir. Look wise.
It is common. Vulgaris means common. Acne vulgaris, pemphigus vulgaris, they are all common type of pemphigus, which is called as pemphigus vulgaris. And similarly, different type of homeopathic drugs used in different type of arts is very commendable. People suffer from warts for a long time. They go from one doctor to another. surgeons are in habit of doing surgery. It is a viral infection, and wherever and wards by nature also. So it doesn't cure, but there is always increase in the size of the wart and look of the wart. On the whole, it was very impressive, and it should be presented in medical meetings also. So doctors are aware about the treatment of warts and different type of treatment which is given. We also do treatment, surgical, lasers, use of different types of acids, use of podophyllene, and we are also successful in treating most of these cases. But patient should be taught about the hygiene, about the use of drugs, and about the treatment which is prescribed, so that they get well. Very much thankful to you for inviting me for this webinar. All the best to you.
Thank you very much, sir.
Thank you,
My
sir.
intention was vulgar is not in that type of vulgar bad, but looks bad. Common words and vulgaris. Anyway, sir, I bow my head before you. Thank you very much for your comments. Well, I was discussing with this palmar keratoderma. Now, the whole picture goes in favor of natrum mute, but I am not prescribed the natrum mute. Why? Because while taking the history, menstrual vaginal discharges, constipation, and very important, chilly. On the other hand, कि धूप नहीं सुहाती, लेकिन ठंड जल्दी लगती है. Could be sulfur? No. Pulsatilla? No. Why not alumina? Tree, thick skin, dry skin, scratching. Well, there is no scratching, no itch. Why not anti-crude? It's sensitive to touch. There's no touch, no sensitiveness. So, my dear friends, it is all, you can say, differential point. So, next. This is follow. Okay. I think it is much sufficient because time is over. Anything else is remaining?
Sorry.
Huh?
Psoriasis.
Psoriasis. Now, let us ask from the Amita, because the time is already over, whether we should proceed or to give a stop here.
So how much time you require for psoriasis?
At least 15 minutes.
15 minutes. Let me ask the chairpersons. Dr. Vahi sir, Dr. Muktinder sir, kindly let me know if we can just give more 15 minutes to Dr. Daryani sir.
Well, I personally feel
He is tired, I feel.
15 minutes for psoriasis would be too short a time. This is my gut feeling. Maybe wrong, maybe right, that's a different question. But I think, because when we discuss psoriasis, it is not only purely a psoriatic condition, but common complication is psoriatic arthritis. And then there are different views about any local applications. So I think we can have it again on next Saturday if convenient to Dr. Daryani. Next will be 17 नहीं 17th सूट नहीं करेगा 3-10-17 क्योंकि टाइम फिर क्लैश होगा एक और मीटिंग के साथ में that will be from 9 to 10. Okay. Well, I think 15 minutes in case Dr. Sahab can do it. Let us.
Sir, no, let us break here. Take the, keep the postpone for the next.
That will be, I think.
Because, you know, psoriasis is autoimmune disorder.
Yes,
There are
sir.
100% chances of recurrence. Then we have to explain the miasma and all other things.
That's
I
what I
think,
think, sir, ke 15 minutes.
but just a look, snapshot. Yes, go ahead. Snapshot. I will not describe. I will not speak anything. Yes.
So at least you can tell us that the remedy you took for this case.
No, I will not discuss because it is lengthy.
Okay, sir.
So many medicines have been changed.
Okay, sir. So on mutual consent, we can decide the date for this particular topic, psoriasis, in future.
Now I will request you further not to any other topic we will discuss next.
Okay, sir.
Snapshot. Yes. This is gutted. That was. This is secondaries. It is again autoimmune disease. Thank you, Gurudev. Thank you. Thank you very much. Thank you.
Thank you so much, sir. Thank you, sir. I request Dr. Wahi sir to give the closing remarks, and after that, Dr. Purnima Shukla ma'am and Dr. Neeraj Gupta sir would
Hey,
like
let me first ask while my Manju Shri is here, because she was quite upset but not getting the link, because there was another Manju Shri from Chandigarh who was earlier she attended, but every time she got the preference, but she was lastly, she is my favorite student. The whole family is medicos, but she is practicing homeopathy. It is something wonderful. Manju?
Yes, sir. Yes, sir. Good evening, sir.
How do you feel now?
I feel good, sir, and obliged that you considered me. And it was really very, I learned a lot from you, and I still admire. But, sir, I want to know about the potencies you have used.
Forget,
and at what
now
stages.
the time is over. There is always ladai in between the what medicine, which potency, why this potency. At least a skilled person should know. Any acute disease should be started with the low potency.
Low potency, yeah.
If chronic acute is there could be a bit mental journal is strong, the high potency.
high potency.
But
Yes, sir.
When the chronicity is there and miasm is persisting strongly, then it should be given always in the high potency. So I'm not going to teach the organon to hear because my point was fixed on the skin. So please don't ask from any person what potency you has given. When I am telling myself, explaining myself that this potency was given. In first webinar where it was related with the kids, I used to prescribe in atopic dermatitis the low potency single dose of sulfur 6 or meserium 6.
Thank you.
Please
Thank you
don't
so
ask anything related with this. Which potency? Which potency? You develop your confidence in yourself.
No.
Dr. Neeraj Gupta is if he here, he will teach me because he is from organ stream. I think he is gone.
Sir.
Dr. Bakshi is here.
No, sir. I think he's not there. I tried.
Everybody is they are it is retiring time now. I have to take my meals and
it was wonderful. It was wonderful, and we thank you so much, sir. And we wish to hear you a lot from you, your experiences.
thank
Dr.
you,
Neeraj Gupta.
Manju. Not more. Now give us full stop here. Give
Okay,
full
sir.
stop here, please.
Thank you, thank you, sir.
Because मेरे घर वाले भी परेशान रहते हैं कि इतनी देर तक काम करते हो, बोलते रहते हो.
Dr. Neeraj Gupta, sir.
नीरज गुप्ता है?
हाँ जी, sir.
तो चलिए पोटेंसी पे वो बात कर लेंगे. मैं तो क्या बोलूंगा, वही
Sir,
करेंगे.
what you have said is correct. Acute diseases may we go with the lower potencies, and certainly where there is a miasm lurking behind. So we have to go anti-miasmatic, intercurrent, very high potencies. You have very correctly pointed out the potencies, so there is no debate on this. And to wrap up, you actually presented wonderfully about 20-25 cases, which covered tinea, which covered allergic dermatitis, and many other areas. So it is wonderful session, sir. I would be obliged that you have been our mentor. I remember that when I was a student of MD in your college, so you had been very strict as a teacher, as an examiner, but you helped a lot otherwise also. And you had a hard, just like a coconut, hard outside, but very soft. So that is
Very
it. So my learning has been with you for so many years. You have a long experience of researcher, as a scholar, as an educationist. So you don't need any introduction. So it is a wonderful session, sir. That is what I can say. Thank you so much.
Thank you, Dr. Neeraj, sir.
One thing I would like to say, I was just going through one YouTube video of Dr. Daryani, sir, where he was asked what are the areas he's interested in, where he excels. So he said dermatology and pediatrics. So that was the two things he answered. So actually, what I understand, क्या होता है कि pediatrics में माँ परेशान रहती है, डॉक्टर परेशान नहीं होता primarily. And dermatology mein, the doctor treating is also not disturbed. So both the cases, Dr. Daryani has a wonderful sleep, I think, at night.
One more area which I had taken up, that is geriatric. ये खुराफाती दिमाग को कुछ करता रहता है. मैं इनकी दवाई ढूंढ रहा हूँ डॉक्टर वाइस की कि ये इतने यंग क्यों हैं, मैं क्यों बूढ़ा हो गया जल्दी. So now I am working on geriatrics.
Very good, sir.
Thank you very much. Now I must take.
Thank you, sir.
Sir, only 2 minutes more because Purnima Shukla ma'am wants to say something.
She is an international speaker. Why to unnecessary bother her? I am not
Purnima ma'am.
to her.
Thank you, Dr. Amita and Dr. Daryani, sir. Your lecture was really very enlightening, and I will request Dr. Nishant to kindly compile all the cases and publish it for us so that we can learn. And Dr. Daryani will have a number of lectures, series of lectures, but we will never satisfy because we want more and more unquenchable thirst from Dr. Daryani, sir.
Definitely.
And I'm sure he will publish all the cases. So your lecture was really wonderful, really
Well,
very enlightening.
Dr. Purnima, everybody knows that Dr. Nishant is my best friend, not son,
I know.
but best friend. He is
I-
always with me, and without his support, I
know,
cannot
that's
do
why this is
anything.
my request only.
No, not
I have
request,
requested
but
Dr.
he himself
Nishant.
is devotee. He
Yes,
himself
yes.
is devotee, and what he has done, I know. रात को 2-2, 2:30 बजे तक पढ़ता रहता है और बनाता रहता है. आजकल
You are
पिछले कुछ
lucky.
दिनों से तो मैं हैंडीकैप्ड हो गया हूँ.
Sir, you are lucky to have Dr.
प्लीज
Nishant.
प्लीज अब बंद कर दीजिए, बंद कर दीजिए.
Thank you.
Now,
Thank you so much.
Okay,
So
sir.
बंद
kind.
कर दीजिए.
Dr. Wahi, sir, over to you.
क्लोजिंग रिमार्क्स से मुझे सिर्फ इतना ही कहना है कि अभी जो डॉक्टर साहब ने बताया कि जीरेट्रिक्स और पीडियाट्रिक्स का जो है वो इनका जीरेट्रिक्स पे काम कर रहे हैं और पीडियाट्रिशियन हैं ये ऑलरेडी. अब जहाँ तक उन्होंने मेरे पे बात कही है तो मैं इतनी कहूँगा कि although coming to the age of geriatrician rather geriatrics, बट मेरे के अंदर बचपना गया नहीं है. तो इसका यही राज है डॉक्टर साहब, और कुछ नहीं.
कुछ नहीं है सर, कुछ नहीं है. बचपन और बुढ़ापा बचपन ही है. के मुंह मिला चिल्ड्रन, के मुंह मिला चिल्ड्रन, के मुंह मिला चिल्ड्रन.
बहरहाल आपकी काफी कई चीजों की पोल खुल गई है, बट एट दिस टुवर्ड्स एट द एंड वो वाकई
Sir,
जो
I have got the Lifetime Achievement Award from the AIMS Delhi on the geriatrics.
wonderful.
You will
Wonderful,
surprise.
sir. Wonderful, sir.
But I have not giving my publicity on the Facebook and all other things. There was a conference in AIMS Complementary Medicine
हाँ.
arranged by the neurological department. And there, not only me, but there were a number of specialists were complementary medicines were there. My name was recommended from CCRH. They asked the names, and I got, but I don't show myself. Publicity, I don't need publicity. Whatever I'm doing for my own appetite.
Sir,
For
we
my
wish.
own appetite. आज एक चीज है, कल मुझे उसी में कमी नजर आएगी. ये निशांत मेरे से बहुत परेशान है कि एक बार दिखा दिया, ओके, थोड़ी देर बाद में आऊंगा, यार इसमें ऐसा करें तो कैसा रहेगा. कई बार झुंझला जाता है. फिर जो आपको अच्छा लगे सो करो, बता देना.
बहुत बढ़िया.
क्या करूं मैं?
बहुत बढ़िया.
रेस्टलेस हूं, इम्पेशेंट हूं, फास्टिडियस हूं, परफेक्शनिस्ट हूं. ये सबसे बड़ी बुराई है.
But
अब
we
मेरी
wish
बुराई
you
कैसे खत्म
a
होगी मुझे
hale,
नहीं
hearty
मालूम.
and healthy life, please, long life.
Yes,
सब
yes,
सब सब ठीक है. आपको देख करके मुझे अच्छा लगता है. सच कह रहा हूं मैं. अमिता, you are my tomboy. Really, I feel very happy to see you.
Thank you, sir.
मैं
Sir, आप
हमेशा रोज
इतना guide
गुड
करते हैं,
मॉर्निंग होती है,
बहुत
ओम साई राम, ओम साई राम से बात करते हैं. एनीवेज, विथ ऑल दीज वर्ड्स, प्लीज अगर कोई गलती हुई है तो मुझे माफ कर दीजिएगा. बाकी
Thank you so much, sir. I now require your permission to end this webinar today, and we will have many more webinars in future for our doctors, for students. And on behalf of IHF, I would like to thank Dr. Daryani sir. आज भी आप एकदम pitch पे डटे रहे और बीच में कहीं पे भी stop नहीं हुए. So thank you sir for your time. आपने इतनी मेहनत करके जो slides बनाई, अपने experiences share किए. And personally, you took lot of efforts for your students, for your colleagues of your college, other colleges, and thanks to Dr. Nishant, आपने अपना time निकाला, इन slides को present किया हमारे सामने. So thank you so much everyone. Thank you students, doctors, team IHF for their untiring efforts to make the event successful. Thank you so much everyone for your time, patience, your energies. Thank you. Thank you. Can I finish this meeting now, sir?
Sure.
Thank you. Thank you, everyone. Thank you.